So I'll keep it short because I'm sure all of you want to ask these 3 questions. Yeah, sorry. I don't have a PowerPoint. I thought you might be PowerPointed out by the end of the day. All right, so I'm just going to talk for a few minutes. Okay. So I'm Maxine, one of the clinical nurse specialists. What is that? Clinical nurse specialist is an experienced nurse. Notice experienced, not old. Okay? You focus on one group of patients, so, you know, your knowledge base is higher than the normal staff nurse, and you've done extra training as well. Normally we follow patients through pre-diagnosis to the investigations, diagnosis and treatments. With GIST patients, that's very different. Obviously we meet patients down the line where they've already had numerous investigations done or been seen numerous times elsewhere, and then they come into Sheffield and they have the diagnosis. So we recognise it's a very difficult pathway, and it's actually dealing with the upset and the anger that this brings. So that's where we come in, I feel, into our own. I work with 2 other ladies, Jill and Kate. We're easily accessible on the telephone, more so than the doctors, but we are the link into the doctors. Okay? We support patients and help facilitate treatment choices and decisions. It can be very difficult for patients when they come expecting that they're going to have surgery, and then we actually say, well, the MDT have said you would benefit from having this tablet before surgery, but it is beneficial in the long run because it will shrink things down and hopefully make the surgery easier. And we have seen that in a number of cases. And it's key providing support all the way through the journey. So it's not just at the diagnosis, some we do see at the beginning, it's also when you come to us and we're talking about the treatment pathways. And then it's also at actually every scan reassessment and every decision point. We're also there for you. And at the MDT, we represent the patient's thoughts, how they're feeling about how things are going. And can you ask, can I have surgery this time? Has it shrunk enough for me to have surgery? We also help and support patients and families when it comes to the point that either treatment stopped working and we have to do a switch, or there has to be a change in management and it just doesn't become operable. We do something called a holistic needs assessment. We don't do it as a formal process, which some nurses do. We actually just eke out what we need by talking to the patients, and it's identifying what their concerns are through a general discussion. And it's not just the physical aspects of life, it's also the psychological aspects, the effects on finance, work and things like that. So we signpost and refer on to appropriate supportive agencies. We also meet patients out of the clinic situation, and we have an excellent support group which Barry and John are in charge of. At one point the nurses used to be, and I'm pleased to say we've progressed. Dumped it on them, winner. So we now, I just book the room and book the teas and coffees and that's it. We're leaving up to them to set the programme up. But I'd just like to think that in general, we're here for the GIST patients. We give GIST-only information out from GIST UK. That's very good and very well received, and the patients always appreciate it when they actually come to us. They've got a diagnosis and they have an information pack and another area of contact. If it's appropriate, we put in the pause GIST information, and we also have a teenage and young adult team as well, if that's, needed. But overall, what we do is we try and hold everything together for the patient. And after MDTs, we translate into English or Barnsley what's being said for the patient so they understand what's happening. We're not bamboozling them with science. All right? So if there's any questions, I'll finish there because I know we're very tight for time. Okay.
Thank you.